female pelvis, one thing we have to know is there are two things. One is false pelvis and another one is a true pelvis. So if we talk about the female pelvis, it will be consisting of four bones. That is, one of them is innominate. Please bear with my diagram, it's not that nice. So one of them is innominate, which consists of one innominate consists of ilium, ischium and pubis. While dealing with the so one of them is innominate, sorry, two of them is innominate, as you can see over here, and one of them is sacrum, which would be located over here, and another one is the coccyx. So these are the bones forming the female pelvis. Four bones would be forming the female pelvis. Now while we talk about the joints, one of the joints would be the sacroiliac joint, okay, the sacrum, connecting the sacrum and the ilium bone, and then another would be the pubic symphysis, and another would be the sacrococcygeal joint. This would be sacrococcygeal joint. So there are three joints, or we can say four joints, because here one of the sacroiliac joint is present over here and another sacroiliac joint is present over here. So there would be four bones and four joints. Now let's talk about the false pelvis. Okay, I'm just making the diagram, which is not very nice, but just bear with me. Okay, so this is like pelvic beam, which is the inlet to the true pelvis. So above it would lie the false pelvis, and this pelvis does not have any obstetric importance. Okay, no obstetric importance. So we have to understand the boundaries of the false pelvis as well. So false pelvis would be formed by anteriorly there would be abdominal muscles. Posteriorly would be obviously the lumbar vertebra, and laterally would be the fossa of the ilium. Okay, now let's talk about, okay, I think I messed up with the spelling, so just see it. Now let's talk about the true pelvis. So while we understand the true pelvis, let's understand a diagram. So just consider there are two ovals, okay. One of them is like that. It's not a very good diagram, so let me make it once again. So one of them is like this, in which the transverse diameter is long, okay. In this, the transverse diameter is long than the AP diameter, and exactly below it we are going to make another oval, which would be having a long antero-posterior diameter. Okay, let me move it slightly in the midpoint. So it's like this, okay. So in which the antero-posterior diameter is longer than the transverse diameter. So usually the female pelvis is such, okay, and I just want you to imagine this. So this is the pelvis of a female, okay. So this is pelvic inlet, and this is pelvic outlet, and over here is pelvic cavity. Okay, so while we discuss about these things, let's talk about the pelvic brim. Okay, because this is the structure which is dividing the true pelvis and the false pelvis. So what would be there is, let's just make a structure. There would be 9 points present over here which are of importance. Right over here, so this is the anterior this is anterior region, and this is posterior region. Okay, posterior region. So anteriorly there would be the pubic symphysis. The first point would be pubic symphysis. Other landmark would be the crest. Okay, crest is the depressed portion, right? So there would be pubic crest, and then there would be a pubic tubercle. It's like elevation. So pubic tubercle. After that there would be iliopectineal line, and this line would be continued. This is the iliopectineal line. So 2, let's write 2 over here, 3 over here, and 4 over here, and this would be continuing, and it would be giving a eminence like of structure. Okay, this is an eminence. Okay, and this eminence is known as iliopubic eminence. And as we go along, this is pectineal line. Okay, pectineal line, and this pectineal line would be continuing, and it would end up in the sacroiliac joint. Okay, so right over here would be, this is 5 number, and 6 number would be, sorry, this is, okay, I did a mistake over here. This is 5 number, which is iliopubic eminence. 6 number is pectineal line. 7 number is sacroiliac joint. Okay, and there, this region. Okay, this region is 8 number, ala of the sacrum. And finally over here we have 9 number, sacral promontory. So promontory. Okay, so what did we discuss? We discussed about the false pelvis, we discussed about the true pelvis. And true pelvis has 3 regions: the pelvic inlet, pelvic cavity, and pelvic outlet. And true pelvis and false pelvis are separated by pelvic brim. Okay, now let's talk about the diameters of the pelvic inlet. This is important. Okay, so in the pelvic inlet we talked, right, there is a, anteriorly there is pubic symphysis, posteriorly there is sacral promontory. So the AP diameter would be formed by, obviously, the line joining the pubic symphysis and sacral promontory. Now over here we need to understand the thing, like there are three AP diameters. AP diameters of the pelvic inlet. Okay, and these include the true diameter. Second one is the obstetric diameter, and finally third one is the diagonal diameter. And when we talk about that, let's make a diagram from a lateral view. Okay, now, so suppose this is pubic symphysis and over here it is sacral promontory. So the line joining the upper portion of the midpoint of the sacral promontory and the upper region of the pubic symphysis, this one is true diameter, and the one joining the midpoint of the sacral promontory and the midpoint of the pubic symphysis is obstetric diameter, and finally the one joining the midpoint and the lower portion of the pubic symphysis is diagonal diameter. Now what we need to understand is, clinically we can measure only the diagonal diameter. Only diagonal diameter can be measured, and once we measure the diagonal diameter by entering through the vagina, and one of the picture is shown there how to measure the diagonal diameter, which I will be pasting over here and somewhere over here. So after doing that, we subtract the diagonal diameter by 2 and we get the obstetric diameter. Now listen to me carefully. It is evident from the picture that in the pelvic inlet the AP diameter is the shortest. What we need to understand is, out of the 3 AP diameters, the shortest one is the obstetric diameter. That's why if the obstetric diameter is less than 10 centimeter, then it is said to be contracted pelvis, and the normal vaginal delivery wouldn't be possible. This is important. Now while we talk about the true diameter would be somewhere around 11 centimeter. Obstetric diameter would be around 10 to 10.5 centimeter, and the diagonal diameter would be around 12 to 12.5 centimeter. That's it. Now when we talk about the transverse diameter, as I stated earlier, so the pelvic inlet is somewhat equivalent to the pelvic brim. So anteriorly we talk about AP diameter was formed by the pubic symphysis and the sacral promontory. The transverse would be formed by the this one, iliopubic eminence. So the line joining the two what do we say, this would be the transverse diameter, and transverse diameter is 13 centimeter in the case of the pelvic inlet, and the oblique diameter is equal to is a diameter which is passing through this region, and let's suppose here is also another iliopubic eminence. So this one is the oblique diameter and it is somewhere around 12 centimeter. Okay, so that's it. So we have completed the pelvic inlet. In the pelvic inlet, it's important that the obstetric diameter is not less than 10 centimeter for the normal vaginal delivery. That's it. Now let's talk about pelvic cavity. So pelvic cavity, every diameter, whether it's AP diameter or it is transverse diameter or it is oblique diameter, it would be equal to 12 centimeter. Now one thing that is important in the pelvic diameter is at the level of ischial spine. So the plane which is at the level of the ischial spine, is the plane of significance because it is a plane of the least dimension, and its value is about 10.5 centimeter. Okay, and this ischial spine, this plane of least dimension is important because firstly the station would be considered as zero, is considered as zero once the baby's head is at this level, number one. Number two, the internal rotation would be occurring at this level only. Number three, the origin of the levator ani muscle is from here, ani muscle is from here. And fourth one, the pudendal block is done at this level. So these things are important from here. Now let's go to the pelvic outlet. In the pelvic outlet would be somewhat like, okay, let me make another diagram. Over here it would be like this, and this is we are having a view from the inferior region. Okay, so here would be coccyx. Here would be the tuberosities, that is the ischial tuberosity, and here would be pubic symphysis. This is pubic arc, and over here would be sacrotuberous ligament and sacrospinous ligament. This is pelvic outlet. Okay, boundaries of the pelvic outlet. So in the pelvic outlet, as I stated earlier, the AP diameter would be longer than the transverse diameter. Just understand, even if the picture does not correspond. So AP diameter is about 13 centimeter, and the transverse diameter, which is by tuberous diameter, corresponds to about 11 centimeter, and the oblique diameter would be 12 centimeter in this case. One thing we need to understand is this ischial spines, or the interspinous diameter. So interspinous diameter is the shortest diameter, and what we just do is we would be this is transverse diameter. Okay, so we would be entering our fingers through the vagina, and we'll be feeling for the spinous process of the ischium, ischial spine, let's say more appropriately, by the fingers, that is index finger and the middle finger. And if we can touch them, it is said to be contracted pelvis again. Okay, so we talked about two conditions in which the contracted pelvis is stratified. So one of them is if the interspinous diameter is not enough, and another one is if the obstetric AP diameter is less than 10 centimeter. So I think that brings us to the end. Thank you.